For this next part of the biology of learning and memory, I plan to talk about the hippocampus and the striatum, so those areas of the basal ganglia. So in the last slide presentation, it ended with the Australian man who was talking about his own experience with temporary hippocampal damage. And I'm going to shorten a lot of this as much as I can, and it's not going to seem that way because when I'm going to ask what's the hippocampus doing for us, it's doing a great deal. A lot of what we know of what the hippocampus is doing for us is from the patient HM. And if you've had any kind of background in memory, if you've taken any class where they've talked about memory, they've probably talked about HM. He is a patient, or was a patient, who had not just his hippocampi, so on both sides, removed, but some of the nearby structures of the medial temporal lobes were also removed. And the pictures at the very bottom are showing various slices that show the area of his brain that is missing now, or that was taken out. And he's probably more famous than most of the memory researchers, as they did a great deal of research on him. You can consider him one of probably the best known case studies in the history of memory, as he lived with this hippocampal damage for decades, and so we could see the long-term effects of damage to the hippocampus. What we saw as the symptomology in HM is what we see with hippocampal damage in general. So he had impaired long-term memory, but his short-term memory, working memory, remained intact. And I used this example last time of him remembering the number 584 for 15 minutes as he went through this strategy and kept it in his short-term memory, explained the strategy, remembered the number, and then as soon as someone distracted him, forgot the number, forgot the strategy, forgot everything. Is that as long as he was keeping something, rehearsing something, and keeping it in short-term memory, he was fine. He had a few weak semantic memories. Really, semantic memories are built up over episodic memories to a great degree, but he had some weak semantic memories from information that was encountered more recently, or information that was encountered after the surgery. So people who had come around after his surgery in the, I want to say it was in the late 50s, if he was given Elvis or the name Martin Luther as first names, he would say Presley for Elvis and King for Martin Luther as last names, which suggests that he had some semantic memory. I do want to say that to some extent, that finishing, hearing Elvis and saying Presley has some amount of implicit memory to it, but it's showing a semantic memory. He had severe impairment of his episodic memory, so he can describe facts from before the surgery, but is not good with personal memories. So with the anterograde amnesia, he was not laying down any new episodic memories, and he could see the same doctors and researchers and do the same tasks and not remember ever having that autobiographical experience. And if you remember what the Australian man said, and so part of what we're going to see with the hippocampal damage is some graded retrograde amnesia as well. And so if we look from before the surgery, he had the facts from before, he had what he had learned from before the surgery, but was not so good with the personal memories from before the surgery, and especially as you get closer to the surgery. He had better implicit memory than explicit memory, so he was still able to be conditioned. There's an example of him sitting in a particular chair and having the puff of air to the eye, the aversive eye blink conditioning, and he would immediately react as if he was conditioned. They would have him sit down in the chair to do the task. He would have no idea what he was doing there. He would have no memory of doing that task, but he was classically conditioned nonetheless, as the amygdala and the cerebellum were still working, and he had intact procedural memory. So he was able to, one of the tasks they use sometimes for this is the mirror drawing task, where you look at a picture and it's in a mirror, and you're tracing the picture from looking in the mirror. And if you ever just go ahead and try and do something in a mirror a little bit, at first it's really hard because everything's goes the opposite way of what you expect, but it gets easier and easier. And again, doesn't remember doing the task before, but sits down and does it surprisingly well for himself because he doesn't remember doing it before, but that procedural memory is intact. And in fact, if I remember correctly, he got some kind of not a factory job, but maybe a factory job. It was where you're doing the same task over and over again repeatedly in his job, and that he was able to learn because it was procedural memory. So if we look at the long-term memory system and the components of that, what was damaged really was that going off to our left to the declarative memory, explicit memory was very damaged. Again, some weakness of the facts, but a lot of that was most likely some repetition of facts that got weakly in a weak state kind of into his brain. And then if we look over at the non-declarative memory, the implicit memory, that is pretty much intact. He still has all of that kind of learning and memory. I repeat here what I've just said really, but this is the nice kind of summarized synthesis from the book of people with this type of amnesia or hippocampal damage show this pattern, which you can read. So if we look at the theories of the function of the hippocampus, this hippocampus is helping us with all of these things, but the first one is that the hippocampus is necessary for declarative memory, especially episodic memory. And they've looked at this by looking at non-humans doing these either a delayed matching to sample task or the delayed non-matching to sample task, where the monkey in this case is given the sample. We're going to show a delayed non-matching to sample task, and the sample in this case is the triangle, and so that's the object they need to remember. And then they also need to remember that this is, as they're learning the task, that this is a non-matching to sample task. They have to remember that this is the task that they are performing in this case. And so in this case, they're going to go look for the food under the new object, and the monkey's going to know that the food is under the circle because it's not matching the triangle. And with hippocampal damage, we see that this is a very difficult task for animals to do. We also see this with prefrontal cortex damage, as there is some working memory in this, but there's declarative episodic memory in this as well, as I'm remembering both my task and what the sample was. The hippocampus is necessary for spatial memory. I got this a lot on the first exam of just it helped us with navigation. And my example before was the research done with London taxi drivers. So remember, they need to know London well enough to be able to answer questions like, how do you get from tourist area A to tourist area B, regardless of what those are in this huge city. And then they also take this simulated driving task test where they are shown that certain routes have construction and they have to find a different way around. They have to really know London. And we see that London taxi drivers have larger parahippocampal place areas, so this area around the hippocampus, than non-taxi drivers, and then larger hippocampi, larger areas than London bus drivers, as taxi drivers are constantly learning the navigation of this very large and busy and changing city. And the longer they're taxi drivers, the larger that parahippocampal place area. We also see they've looked at rats in these radial mazes where if we have something like, let's say some of these floorings are have a light down them or have carpet on them. I'll use carpet. Have carpet on them. The rats with hippocampal damage can learn that as if they have food under just some of the radia off of there, if they have food in some of those and food is never on the carpeting, the rats will learn to avoid the carpeting, but the rats do not learn to avoid looking in places where they've already looked. So if they've already looked and they've gotten food, or there is no food, they don't need to look back down that radial, that part of that arm of the maze. And yet they'll keep looking down the same arms of the maze that they've looked down before, because they're not creating that memory for their spatial orientation. The final theory of the function to the hippocampus, and I'm saying the hippocampus really helps us to do all of these things, is how these theories came along, and how they fit together is really the question. So the hippocampus helps us to remember the details of context. If we think back to those older memories, remembering those memories, bringing those up, like me talking about my 5th grade birthday party, that involves the hippocampus less than me talking about something that happened a couple of weeks ago. As we get into the older learning, or things that are older and back farther in our past, they really have less context. So the more consolidated a memory becomes, the less it depends on the hippocampus. So another really important brain area to talk about when we discuss learning and memory phenomena are the basal ganglia. And at the very end of all of this, I'm going to say, because I want to make sure I say this here, that many regions of the brain are involved. Learning and memory phenomena are a complex bunch of phenomena that give us this sense of self, really. And you could see that with that long-term memory, short-term memory, the components of memory, just how many components there are and how much of this gets put together. But another kind of learning is this procedural learning. And I have talked about the basal ganglia and their relationship to procedural learning before. And we have talked about things like how it's not just muscle memory. So when I learn to type or learn to ride a bike or play the piano or whatever, that is an example of procedural learning. And we talk about it as muscle memory a lot of the times. And usually that's what students mention to me, is it's muscle memory. But there's more to procedural learning than muscle memory. And this can have a cognitive component to it. So as we're learning our habits, there are cognitive aspects of that. But also as we are experiencing patterns in nature, patterns in the world, we're learning through our experience in this kind of gradual way, a way that is difficult for us to explain to somebody else how we learned what we learned. And this is happening thanks to the striatum, really the caudate nucleus and the putamen, those structures of the basal ganglia. And he gives a really great example in your book that I suggest you walk yourself through and just do the blue triangle, purple triangle task there, and see how you do at the end, and how you feel about what you learned in that little bit of exposure to the task, and realize that what he's saying is you're not going to learn it from these 35, 34 items. This is something that takes time to learn the pattern, and when you get better and better at the pattern, but it's really difficult to tell somebody else what the pattern is, or how you learned what you learned, or what the rule is. If I read my slide, it's gradual learning. You can't state the rule. You use the basal ganglia. I have this example of the weather task. His is also called a weather task, but I'm supposed to say whether it's going to rain or not. And in this case, I might say, so let's just pretend if there's a butterfly and a boat, I know it's going to rain. If it's a boat, it's likely going to rain. If there's a light bulb, it's likely going to be sunshine. But in the case of the butterfly and the boat, I know it's going to rain, or it typically rains. So as we put these things together, and sometimes I'll see a light bulb. It's definitely going to be sunshine, right? But as we first start doing this task, we get to know, well, the light bulb means sun, usually, and the boat means rain, usually. And so we might have these confusing times of what happens when I have a light bulb and a boat, or how many light bulbs, how many boats. But so at first we're usually around 53, maybe 60, 64. I can't remember the exact percentage, but we're doing okay at predicting the weather. I think we're at like 64, like we're better than chance. But as we do this task longer and longer, we get up to something like 94% accuracy. And what happens with people who have damage to the basal ganglia, so this actually includes, if you remember, Parkinson's patients, they never get up to the 94%. They start out doing pretty well at the 64%, but they stay at the 64%, and they never do this kind of gradual learning. Just to compare this to people who have hippocampal damage, they're not getting it. They're not getting the light bulb means sun or the boat means rain. And at first, they're lower than 64% and they're at chance. But as they do this task over and over again, they do learn the overall pattern and they do get up to, quote, normals, so around 94%. So because their basal ganglia are intact. Nope, so I just said this on the previous slide, but I'm going to go through it with words and more officially. People with Huntington's and Parkinson's disease, they perform like normals at first, at the 64%, but they don't get up towards that 100% accuracy. The gradual learning is what's impaired. So they have trouble learning new skills, especially motor skills. They can remember new facts. Callatt discusses two other types of amnesia, Korsakoff syndrome and Alzheimer's disease. I'm going to start by talking about Korsakoff syndrome. In this disorder, the people lack thiamine for an extended amount of time, so neurons can't metabolize glucose properly. If you go way, way back to the nutrients of neurons and how neurons work, if you remember, they're utilizing glucose and oxygen, but in order to metabolize that glucose, they need thiamine or B1. What happens is this Korsakoff syndrome occurs when people are pretty much chronic hardcore alcoholics. These are people who are drinking hard alcohol a great deal of their life in order to get Korsakoff syndrome. It's not something that happens because of some alcohol use, but over time, your author says that it is because their diet is basically made up of alcoholic drinks, but that's not the whole truth, as what happens is when you are drinking alcohol, you are not really taking so many nutrients into your body. It closes the villi of the intestines, and it particularly leaches off vitamin B1. So you are not metabolizing thiamine at all when you are drinking alcohol really chronically and pretty hardcore. The first areas, or the area that's most affected, is the dorsomedial thalamus, and this is a main source of input to the prefrontal cortex. And so some of the impairments of Korsakoff syndrome look kind of similar to people who have damage to the prefrontal cortex, because this is the connections, a main source of connections to the prefrontal cortex. So we see some apathy, some confusion, and some memory loss, as there's often confusion when we're losing a lot of our working memory. But what we're really seeing is that kind of not laying down new memories well either. And another aspect to this disorder is that they confabulate. Okay, so they will make up what they remember to be true, if you will, and they are not confabulating weird and wild stories. Usually what they're doing is remembering something that happened at some point in their lives and saying, yes, I did that last weekend, because they don't really remember what they did last weekend. I always thought that maybe this confabulation came from a strategy of when we do black out when we're drunk, that we other people are telling us stories and we kind of fill in those memories, and so we're starting to make up memories. But this kind of confabulation occurs with several different kinds of disorders, not just Korsakoff syndrome, and it appears to be something specific about the brain regions that are damaged here. All right, my PowerPoint presentation was getting a bit long, so I want to cut this here. I'm cutting it kind of in the middle. I just talked about Korsakoff syndrome. I'm about to talk about Alzheimer's disease, and we're in this context of the different types of amnesia.